Today we're talking all about 5 really important things you need to know about PCOS and getting pregnant. Hi ladies, welcome back to Fertility Mom. If you want all of the science-based tips, tricks, and secrets to help you get pregnant naturally and faster, then subscribe to the channel and hit the bell so you know when I give you new stuff every week. So we're going to be talking a lot about PCOS on the channel, if that's what you want. Today's video is about PCOS, but I want you to comment down below if you want me to do more stuff on PCOS. Hit me with questions or any kind of thing that you want me to talk about, and definitely hit the like button so I know you want to see more videos about PCOS specifically. Today we're going to be talking about 5 really important things that you need to know, and watch to the end because we're going to talk about the actual root cause of PCOS and why what our current medical model does to treat it doesn't actually treat it. So number 1, PCOS is actually the main cause of fertility issues, and most women who have PCOS don't know they have it until they try to get pregnant and fail. And I see this a lot with women that I work with, is that they've been trying for a really, really long time and they don't get a PCOS diagnosis for months and months, and sometimes even years it takes them to get an official final diagnosis of what is going on with them. And this is for a variety of reasons, but one of the main issues is most women who have it don't actually exhibit the usual signs and symptoms that you associate with PCOS. Which brings me to number 2. PCOS does not always present the same way, and signs and symptoms can actually vary a lot from woman to woman. Now, you'll know that common signs and symptoms of PCOS are irregular periods, maybe periods where you ovulate very, very late or you don't ovulate at all. You may have hair growth on your face, your chest, or other areas in your body. You may have thinning hair on the top of your head. You may have weight gain, inability to lose weight, high testosterone, acne, lots of other things as well. And these are just to name a few. But one of the main things that you'll see with PCOS is fertility issues or infertility. I hate the word infertility. I prefer fertility challenges. So you'll hear me use fertility challenges from now on. But you will see a lot of fertility issues, fertility challenges with women who have PCOS, and sometimes that is the only thing that they actually exhibit. Number 3, researchers have actually discovered a genetic component to PCOS, or a gene that they say may cause PCOS. And some news articles have actually reported that this is the cause of PCOS. And that's not altogether true. While you may have a genetic component to PCOS, what we now know in the study of epigenetics, or the study of things above the genes, is that there are very important environmental factors at play to actually turn genes on or genes off. So there is a specific type of gene that's related to PCOS, but that's not the only thing that you need to have in order to actually exhibit signs and symptoms and have problems with PCOS. There must be an environmental factor in place for you to have PCOS. Which brings me to the very important to know number 4. The actual root cause of PCOS is insulin resistance and inflammation. And yes, I've talked about both of these things ad nauseum in lots of my other videos that I will absolutely link to up here or down below in the comment section. But this is incredibly important to know and understand. So I'll briefly go through it here, but definitely check out the other videos because I do believe I talk about it at length in some of the other videos. So when you eat some things, and for many people this is anything, especially if you have the mainstream type of diet where we're mostly carbohydrate loading, when you eat, your glucose goes up. And when your glucose goes up, your body releases insulin to bring it back down into normal range. Your body's always trying to find its normal happy place. So with continued high glucose and then insulin release and then glucose and then insulin release, what happens over time is your body actually becomes insulin resistant. And what this means is that the receptors on your cell actually downregulate, meaning that they stop listening. They're just tired of hearing insulin shout at them all the live long day. And so the cells just become a little bit like, ugh, all right, enough insulin. But the body still needs to do what it needs to do. So it starts even more insulin, like more insulin is coming at the cells. And this is the thing that actually causes the high testosterone or the high androgens. So higher levels of insulin actually cause your ovaries to produce more testosterone. And this is the thing that drives your hormonal imbalance in PCOS. Now, there's also the added horrific thing that insulin resistance feeds inflammation, and inflammation feeds insulin resistance. It's this really, really vicious cycle. And if you don't stop it, then you're just going to be in this horrible circle where your insulin resistance is feeding into inflammation, and your inflammation is feeding into insulin resistance, and the high insulin is creating higher testosterone, and it's creating all of these different hormonal imbalances throughout the body. This is not just fertility related. This is going to be all over your body. Like, our endocrine system is not just in like this little capsule. It's all over your body. It actually goes through every single organ. So this is incredibly important to understand. The root cause of all of the hormonal imbalance issues that come with PCOS come from insulin resistance and then inflammation. And these two things play off each other a lot to cause these hormonal imbalances. Which brings me, of course, to our very important number 5 of how do we treat it. The best way to treat the underlying root cause of PCOS is to actually change your diet. And I know that sounds really simple for such a big problem, but that is the actual root cause. That's the basis of what's happening. Is you want to control that glucose, you want to control that insulin, and you want to control the inflammation. So this whole wheel of inflammation into insulin resistance and all goes round and round. You can break that cycle easily with a really big, I guess, for some of you it's big, with a big change in your diet. Many of you are talking with your doctors and you're trying to figure out how you're going to manage the PCOS in light of trying to get pregnant, and you're taking medications like metformin, which is a diabetes medication, and other medications as well. And these only spot treat symptoms. These don't actually treat the underlying cause of the problem. And we're known for this in medicine. We just like to spot treat things. We don't actually like to dive in and treat the root cause. So you'll be taking lots of these medications to try and override the body, and you're not actually going to be successful. Many of you are not going to be successful in overriding the body enough so to get pregnant without doing the dietary changes as well. I'm not just going to sit here and tell you not to eat sugar, because I know most of you, if not all of you watching this video, know that you shouldn't eat sugar when you have PCOS, but it goes much deeper than that. There's a lot of mainstream dietary information, especially in the fertility diet world, that we get that does actually cause inflammation as well. And that's because the mainstream diet causes inflammation. It's just one of the things that it does. It doesn't actually take into consideration the actual science of food. So yes, there needs to be a big dietary change. I know you shouldn't be eating sugar, but there are a lot of other diet changes that you need to make as well. I will link down below to my other videos that I have made about the diet that you should have while you're trying to conceive. I definitely recommend going and watching those videos, because that's going to be really crucial information for you to know. Also, if you're interested in learning even more about a fertility diet, I encourage you to head to my website, also linked down below, and download the free 5-step fertility boosting guide. I have a whole section in there about diet where I talk about some of this inflammation stuff, and I give you some really awesome fertility diet tips in there as well. Okay, that was our first video on PCOS. If you want to see more, or you have specific questions or things you want me to talk about in relation to PCOS, please comment down below and hit the like button so I know you want to see more stuff like this. I am so glad you joined me here today on Fertility Mom, and I shall see you next time. Bye, ladies.